Yay, good evening, colleagues, and I hope you are well. Welcome to the clinical care platform. Today, it's a very short session, it's an information session, just sharing with you what you can expect on one of our upcoming master classes. Are you guys well? How are you doing? From where are you joining? Let me see who is here. Yay. All right. Anel Fori, Dr. Da Silva. You remind me of the olden days when you were still at Drops there and we were fighting, winning the battle against HIV. Such a great honor to reconnect again. Hi, Aisha, Buipilo, Daniel, Dolly, Docas, Dr. Elaine. Dr. Matebane, Dr. Ngwenya, Eric, Ziggy, yo, colleagues, I can't count all of you, but just to say good evening and welcome, Dr. Nondumi, so Siboyeng, yes, you are welcome, welcome, Martin. Yeah, colleagues, you are all welcome. It's a short session, and maybe let's continue from here. Sister Matabelo, I see you. Sister Machele. Dr. Okay. Kadaga, Mulebuheng. Yay. Yeah, no. Let's push. Yeah, good evening, colleagues, and welcome. This is the clinical care platform. Today we are discussing ophthalmic an upcoming masterclass on ophthalmic emergencies, and I've just shared the link there for you to read a little bit about it. But let me share my slides and take you through a couple of things, and then I'm going to hand over to my dearest Dr. Mufugeng very shortly. So yes, we want to discuss what you can expect this coming Saturday as you join us. And just to highlight that we have a mission as a platform, which is to improve patient care. But our main goal is to achieve this by enabling you, the health worker, to be the best version of yourself, to be competent, to be very confident, and to join this community of professionals who are committed to learning every day, to growing every day, so that tomorrow we are better, we are ready, to care for our patients. These are some of the things we aspire to do as a platform, to be very simple, to respond to your needs, to provide education such that the geography and where you stay are not limitations, and hence we have embraced the virtual approach to how we can bring to you continuous professional development. We are a member-based platform, so please do join us on this journey. Do visit our website, explore why you need to be joining the membership. And I'm hoping that you appreciate that there's going to be more value for you versus maybe the cost of joining our membership program. Whenever we call you to join us for a masterclass, we're looking at big topics that are very important, that are very impactful, and how we can put them together such that they can help you, because you're already a qualified professional, generally speaking, but just to enhance your abilities and to ensure that you remain confident. So these are high yield, lots of information shared over a short period of time, but in a high impact way. And I think the positive side of this is that for every masterclass, immediately after we complete it, we put it together as a self-paced version of it, which you will be able to access, to replay, so that you can enhance any questions that you may have during the actual program. We do continue to build the list of our masterclass programs, and you will see that this coming weekend we have the ophthalmic emergencies. Then we have the final part 2 session. We have actually covered all systems in terms of the FCP part 2 for internal medicine. I'm so happy about that. And we're going to close on a high note looking at cervical cancer prevention and management as we close off Women's Month. And Dr. Magagula is so ready to take us through everything around that particular topic. Just to remind you that our diploma preparatory programs are open for registration. The coaching programs will start in October. There are programs where I would really recommend that you start early, especially child health and the HIV diploma, because they have requirements. If you are to apply, that you must have completed IMCI for child health and the basic and advanced courses for the HIV diploma. So, but yeah, you still have enough time because October is a little bit far. And yes, if you are here and you are a nurse and you want to master HIV medicine, join us on the week starting the 25th for a clinical training, which I will be facilitating. So it's an in-person event in Johannesburg. Visit our website or drop us an email, info@clinicalcareplatform.com, if you would love to learn more about it. But well, today we are discussing the upcoming masterclass this coming weekend, starting at 8, finishing at around 2. And we are going to be hosting Dr. Thabiso Mofokeng. I think he's already known to the platform because we have already done a number of topics already. But he is a specialist ophthalmologist. He's a qualified medical doctor. He is a diplomat of the College of Medicine of South Africa in ophthalmology, but he's got a master's qualification from VET, but also he is a fellow of the College of Ophthalmologists. Let me not waste a lot of time and hand over to him. And as soon as he is done just telling us about the program and what you can expect on Saturday, I will just help you then on how you can best navigate our website if you are interested to register. Dr. Mufugeng, can I hand over to you, my dearest brother? Let me see. Yes, we can see your slides. Just check if you are unmuted. You might be muted. Let me see if I can.
I was muted.
Yeah, now we can hear you loud and clear. Thanks, Doc.
Yes. Good evening, colleagues. Good evening again, Dr. Mawela, and thanks again for the opportunity. Today, I'll be very short because it's just a prelim, if I can put it like that, to what's going to be our masterclass, our first ophthalmology masterclass, this coming Saturday. Basically, at least just before the big game, we will do some, and I won't ask who's supporting
Small
what,
game.
but yeah, yeah. So basically, our discussion will be divided into about 4 sessions. And the first session, of course, we'll start with an assessment of an eye in an emergency setting. Because of course in an emergency setting, certain things don't follow certain stepwise procedures that we are accustomed to. But it's important to note that in any setting, if you do an ophthalmology assessment, visual acuity must always be noted. I always emphasize that. It's important for you to be able to, at least you'll be able to kind of prognosticate in terms of what you're dealing with, but also for medical legal purposes, you must always note down vision when you assess these patients. So, but basically, we're going to come up with a toolkit of what do we need to have to assess patients in an emergency setting. Just to say, to tell a brief story, as medical officers and registrars in ophthalmology, we carry a bag. So in that bag, you will have a direct ophthalmoscope, you will have an anesthetic drop, you'll have fluorescein, and sometimes you also have things what you call lead retractors, and a few maybe lenses as well. But if as an individual one can have that for themselves, because you used to go to different hospitals when you're on call, I think our ER rooms should at least come up with that kind of a toolkit. So, but by the time we are done with the first session on Saturday, we'll compile. We'll compile a nice toolkit, and of course we'll also when we we'll talk about how you examine the anterior segment, how you examine the posterior segment, how you assess the optic nerve regarding things like the pupillary reflexes, and of course the red flags that must always be in your mind when you're assessing this patient. And I must also emphasize that I'm not expecting us to be very proficient with the direct ophthalmoscope to do a fundus exam once we are done with this talk on Saturday. But this is the start where we say, number one, we should acquire this instrument. We should get it for ourselves, and you should start doing it. Basically, you should start using it with your patients. The more you do it, the more you get confident with using it, and the more you see the normal eyes. So even if you see a 40-year-old with a headache and just say, "Can I examine your eyes?" You start there, getting used to normal pupillary reflexes, getting used to say, when I'm examining the anterior segment, this is what I normally see. Such that as you get used to it, as you get used to seeing a normal fundus, even if something is weird in the fundus and you don't know what it is, but you'll be able to say that this fundus is not normal. So when you take a phone and say, "I'm phoning Mofokeng, and Mofokeng, Dr. Mofokeng, I've got a patient with a cloudy vitreous. I don't know what it is. But already for me, I would worry about vitreous hemorrhage or a retinal detachment." So I'm just saying that the more you get used to this instrument, the better, especially the direct ophthalmoscope. For example, a patient comes with swollen lids like this, whether it's from trauma or it's from orbital cellulitis. How are you going to handle this? I mean, do you defer visual acuity? So that's why I'm saying this. As when you discuss these things on Monday, I mean, sorry, on Saturday, we'll go into depth in terms of how do you assess patients that come to our rooms with all these. I mean, to our ER with this kind of scenarios. This is just this toolkit. I just wanted to illustrate the direct ophthalmoscope. Mine is a YF, but there's different types. Well, I mean, one of the popular ones is, I think they call it Hein. But I'm not. It's really up to you in terms of which one you want to get for yourself. But when you buy an ENT set, most of them they also come with a direct ophthalmoscope if you ask them to add it. So we'll conclude session one with a few audiovisual clips on exam techniques, just to obviously elaborate on what I would have said in terms of the content itself. And I'll obviously bring up some various tips that I've accumulated along my journey as well. And then we'll just conclude session one with a few questions. I mean, with questions as much as you want. And hopefully we'll all get the answers as well. Now, session two, it's actually one of my, I don't know, I mean, it's one of those things that I've got a soft spot for, because, these emergencies, it's between you and somebody losing their sight, or even worse, somebody losing their life. And unfortunately, these patients, as much as most of their problems are neurosurgical, they will start at an ER. An ER will phone an ophthalmologist if they have an ophthalmologist, or they will start at the clinic. So I mean, it's important that we go through, especially the ones that I've seen in my life. I mean, the ones that I've mentioned here, there's many other emergencies, but these ones are from my own personal experiences that I've seen during my time as a medical officer, all the way up to as a senior registrar. And of course, we'll touch a bit on introduction and epidemiology. The epidemiology, it's important because it gets us to think when you see particular presentation, to say, actually, could this be something that I should worry about or not? And we will talk on the third nerve palsy, but specifically the surgical third nerve palsy. And then we'll talk about arthritic anterior ischemic optic neuropathy, giant cell arteritis. Somebody might ask, why are we discussing GCA? I mean, it's commonly described to be seen more in the Western countries. I've seen one, and it was atypical because, I mean, people say it's common in white females of above 50. The lady that I saw was a black female. So I'm just saying, once you see these things and you know the signs, even if it's an atypical presentation because it's not the race that you're expecting, but because of, this is what we discussed on Saturday, this should be most likely this until proven otherwise. So we need to be able to handle those situations, especially to be able to pick it up. I think what's important is to pick up the problem, and once we know what could be what's wrong, we will be able to know what to do next. I also included IIH, idiopathic intracranial hypertension. This is not a true emergency, but it's fairly common. I was actually very impressed. I got a referral from one of my GP colleagues, and she was very spot on to say this is IH. I mean, by the time I did the workup and the conclusion was IH. So why it's important is because you don't want somebody to lose sight from something that can be prevented. So the sooner we pick it up and we treat, the better, because of course the outcome will be good. Because these patients, they present with good vision, but they can lose their vision if ever the diagnosis is missed. So, I mean, if you say somebody's got a headache and you think, no, the blood pressure is normal, you ask about stress and you treat as if you're treating a normal headache, you could be losing that safe window period to be doing the actual appropriate treatment. And then here I mentioned cavernous sinus syndromes. I specifically put it like that because here I'll be discussing what we call pituitary apoplexy. So we're going to talk about pituitary macroadenomas and their complication, which is pituitary apoplexy. But here as well, we've got things like cavernous sinus thrombosis. As much as it's in the brain, but I mean, this could be a spread from things like sinusitis and all that. So that's why I just put as syndromes, but on Saturday I will divide it accordingly as well. And then, I mean, we'll touch briefly on diplopia, how you assess a patient with diplopia, but our main focus will be on organic disease. You know, I mean, we know that we do get some patients will have diplopia, but you find that it's more like psychological, or and I mean, I'll actually be focusing specifically on binocular diplopia, because monofocal diplopia is almost always non-emergency. You know, it could be a refractive error, a subluxed lens or something, but it will not, it's hardly an emergency. So I'll be focusing on bifocal diplopia. And then session 3 will be on trauma. And the main one, chemical injuries, penetrating injuries, and intraocular foreign bodies. Chemical injuries are, we unfortunately live in a society where there's a lot of violence. And besides even the violence, I mean, even accidental eye splashes from home. You know, actually, you'll be surprised that at home we have a lot of alkali chemicals that one can get exposed to. And of the two chemical injuries, you know, we divide them into acidic and chemical. And you'll be amazed that actually the alkali injuries are the most sinister one compared to the acidic injuries. So our corneas can take acidic injuries far better compared to alkali injuries. But we will go into details and we'll present a few cases as well, because I'm going to try to make this thing not to be content heavy. It will have to be like case scenarios, some of my personal cases, and obviously as interactive as we can. And then the fourth session, it will be on the retina and vascular emergencies. As I've already said, that I don't expect us to be very proficient with the direct ophthalmoscope for looking at the fundus on day one. But if we practice doing this, if we look at the fundus when you get an opportunity to look at it, you will pick it up when there's something wrong with it. You will be able to pick up that there's vitreous there's hemorrhage on the retina. The more you do, the more you see the normal ones, the very quickly you'll be able to see the one that's abnormal. I mean, we'll also go on things like retinal detachment, because I mean, you know, in ophthalmology and I guess in medicine in general, listening to what a patient tells you, that on its own can give you a diagnosis before you even go and touch that patient. So patients with retinal detachment, their history is usually amazing, because you would expect it to be like that by the time you look at the patient, because of a few statements that they make. And then, like I said, we also look at multiple clinical scenarios as well. And then we'll look at an approach to sudden vision loss. that will obviously cover the retina as well and the optic nerve to a certain extent, and obviously the brain itself. And we'll have a multiple case presentations of in the very same topics as well. And then the last session will be on glaucoma emergencies. As I've already mentioned, that it's important to listen to what the patient tells you. I saw a patient recently, a young man who presented saying that, what, doc, I was watching TV, I was watching Netflix or something. Now I've got a severe headache and nausea, vomiting. That, and that's a typical history you'll get in an acute angle closure glaucoma. So, the more you listen to these things, sometimes it might sound like it's not an information that's very beneficial, but if you have a high index of suspicion, you'll ask those direct questions, and they will lead you to your diagnosis, because this is an emergency, acute angle closure glaucoma. And then we also discuss pigment dispersion glaucoma. It also gives a particular history. I mean, I'll give some case scenarios as well. And I mean, maybe we'll quiz each other in terms of what do you think could be wrong with the patient once I've given you the typical presentation on the history and all that. And then I'm sure we'll close on your vascular glaucoma. We spoke recently about diabetic retinopathy and the staging thereof. I mean, so neovascular glaucoma is one of the end stages that you can get from proliferative diabetic retinopathy. But many other things can cause this. I mean, things like your central retinal vein occlusion and your central retinal artery occlusion, of which we are going to discuss as well in great length. But like I say, we shouldn't worry about all these terminologies. I mean, I'm going to make it as practical, because I'm a practical person myself, and I'm going to make it as easy as it can be understandable, because I'm also like that. I mean, I want to simplify things, because that's how I get to remember them myself as well. Dr. Mawela, I think just in conclusion, uh, we'll have a frank discussion, on how we can close the gap between our general practitioners, our primary healthcare facilities, and the eye surgeons, because like I say, the entry point, unfortunately, to these patients, it will be in an area where there's no ophthalmologist available on site, and or maybe there's no neurosurgeon or neurologist available on site. And maybe as a parting shot, I always get in trouble by saying that statement. We must never allow uh, other people's problems to be our problem. So if a patient needs to be referred to a neurosurgeon or an ophthalmologist, and someone says to you, I don't have a bed and what, that's not your problem. Already you are dealing with the problem of patients to say, what, the patient spent his last month to come and see you, and now you have to deal with Mufugeng who says I don't have a bed for the patient. That's my parting shot. As long as you pick up the diagnosis and you know what's wrong with the patient, no one must be able to be saying to you, don't send that patient through. But of course, I mean, there are certain things that we need to do on our side while we're still waiting for this patient to be taken over by whether a neurosurgeon or a neurologist or an ophthalmologist. Doc, thank you very much. I think that I will end there for now.
Thank you so much, Doc. Colleagues, yeah, I hope you get a sense of, what you can expect this Saturday. I'm so excited because you can see the program is quite comprehensive, and from some of the things that are very, very urgent, but also things that are very, very common. So I'm hoping that you'll be joining us. Let me just share my slides, I mean, my screen, because I just want to show you how to navigate the website if you're interested to register. Let me see. How do I do this the best way? Okay, I've just shared my full screen. I'm hoping you can see. So basically, you'll need to just visit our website, www.clinicalcareplatform.com. Once you get there, you'll be on our home page, which is the one you are looking at. You can join membership if interested. But if you scroll down on the home page, You'll see the ECG Masterclass, which has just passed, and the next Masterclass would be the Masterclass on Ophthalmic Emergencies. And you can click on Learn More so that you can read more about the course and what you can expect. Alternately, if you go to Workshops on our menu there, where is it? I think I lost it. On top, if you go to Workshops, there on top, Workshops, you'll find some of the workshops there. I mean, most of our master classes are also listed there. So I'm going to just click on Learn More just for me to read a little bit more about the master class itself. So it's happening on the 16th, 8 o'clock to 4 o'clock. It's a virtual event, so you can join regardless of where you are. It's not a free course. It's $950. If you are a member, you'll be eligible for up to 10% discount. You can read on some of the topics or areas of interest which will be covered, and etc. etc. You can see there it's accredited for at least 6 points. That's what we are accredited for. If we go beyond that, we will increase it, because the first time we run the master class, we have a theory that we will be finished by 2, so we should be good. And that as well, after the master class, you'll have access to the recordings so that you can fast forward, rewind, pause, and review any areas of interest. And you can see Dr. Tabiso is our instructor for this particular program. If you have made up your mind that, yes, I want to register, you can book your seat here on top, or on your right hand side. You can register today. You can choose any of the two. They'll take you to the same page where we now register and pay for this masterclass. This is our registration and payment page for this particular masterclass. If you scroll downwards, you'll be asked, would you also like to join the final session on dermatology, etc.? If yes, you can click there. If you register for both at the same time, you'll be saving 100 rands there. But registration, we don't require a lot of information from you. Is Lesego Mawela. I think this one is only available virtual live. Please don't click on in person. We don't have in person, but if there are people, we can always make a plan. Your email address, your contact number, and your council registration number, and then you continue to pay. You'll see that our page or our payment gate is managed by PayFast. So PayFast is the one that communicates between you and your bank. It's very secure, it's well trusted, it's the #1 card payment system for online payments here in South Africa and in other African regions. So yeah, be at peace that your information will be protected. Few things that maybe I can try and show you. If you can see the fee, it's $950 there, right? If you remember, there's a message there at the bottom. It says apply for coupon code. That means you want to get your 10% discount. You just click on it, on that green piece there. Then you have to type in capital letters member 25. Make sure there's no space between the member there. Even after the 5, there's no space, and there are no spaces in between, and everything is caps locks. If you say apply, you'll see that your fee is now recalculated. You are saving 95 rands. That means your registration fee is 855, right? Also, if you decide to say, I want to add the FCP part 2, you'll see that you're gonna save a further 100 rands for registering for both. All right. The other thing, some colleagues are joining outside the country. Maybe your systems don't allow you to pay in rands. You can actually pay. You can change the currency there and just choose US dollars, and then it will be converted. You can see it's $48. That's equivalent to what the fee is in rands. Yeah, and then you click continue, you put in your card details, and you should be okay. If you struggle with this process, please don't panic. Just drop us an email at info@clinicalcareplatform.com. If you do that, we should be able to help you as needed. I think we have ran out of time, but I just want to see if there are any questions. Maybe Dr. Tabiso, can I just check, is this a program mainly for specialists and medical officers, or do you foresee nurses, and I mean we have eye nurses and many other people, can they benefit from this program?
Any healthcare worker, from nurses to doctors,
Mm,
because for example, a patient that comes with chemical injuries,
mm,
before they're even seen by the actual casualty officer, they're seen by a nurse.
yeah,
So they need to know what to do. And it's like I said, it's going to be as practical as it can be. So any
awesome.
healthcare worker, obviously it's for doctors, but
Mm.
even nurses will benefit.
Awesome, awesome, awesome.
Yeah.
Colleagues, just a few administrative things which are general, common questions. One of the questions we usually get with master classes is that I'm not available on Saturday. Can I join? And the answer is yes. You may pay before the event starts. You will get access to the self-paced version, which you can complete at your own time and still get your certificates and CPD points. One of the common questions is, I'm not a member, will I get CPDs? Yes, because this is a paid event. If you pay and you register and you attend properly the course, you will be able to get your CPDs. And generally speaking, we report them as soon as Monday. Usually by Tuesday, Wednesday, you should have received your SMS from the council that your CPDs are locked, and the self-paced thing, so that you can review it, you need to give us at least a couple of days, but usually by the end of the first week we should have it ready and start to enroll everyone. All right, so yeah, please colleagues, feel free to type in any questions that you might have. But yeah, maybe from my side, Dr. Tabi, so what about your colleagues, your ophthalmologist who's joining here and is thinking, "Ah, I need CPDs, but I'm not sure if I'll get value from this thing because I already know what time is going to teach about." Do you think colleagues can benefit from this as well?
Uh, Definitely, anyone, even an
Yeah.
ophthalmologist, will benefit because remember, for example, pituitary apoplexy,
Mm,
it's very rare. Not you can't even think about it
yeah.
until it happens to you. So, I mean, obviously, I had to tailor make the discussion more towards
The
for general,
generalist. Yeah.
general. Yes, So
Mm,
even for example, I mean, I've given this talk of neurophal emergencies.
mm,
I actually gave it to neurologists during my reg time,
okay.
and it was custom for that. So this one I had to obviously modify it to remove some of the things that I feel that they are more academic than for everyday what we see in our rooms.
Awesome. Awesome.
Already,
Awesome.
I've got colleagues who said they want to register. So
Yeah, no, no, no. And
yeah.
I can guess why, because I don't see a lot of ophthalmology talks anyway around. So I think it's something that
Mm,
we easily neglect. So I'm so happy
mm,
for this opportunity. All right. So colleagues, as you are
mm.
listening, how are you feeling about this masterclass? Do you think you will get a good value from it? Are you looking forward to join? Give us a sign. Either I see hearts, I see some thumbs, or a yes there in the chat, and say yay. My confidence on I is low. Hopefully, after this session, things are going well on your side. Okay, thanks, colleagues. Yeah, I think let's call it a night. If there are any other questions, drop us an email, info@clinicalcareplatform.com. Dr. Kabambis Alexis says, please, doctor, can you repeat about those who are not available? I want to watch later. Yeah, you need to register before the event, because we don't. Master classes generally are not on sale, so you need to register before the event, and then in the following week you'll get access to the self-paced version, which you'll be able to watch everything complete, get your certificate and CPDs once you've completed everything. We will make it available to you, but you need to register before, not after, please. Ne? So, yeah. I hope that is clear, Dr. Gabambi. I hope that helps. Yeah, awesome. So you'll be able to access the material post the event. Okay, colleagues, let's call it a night. Dr. Tabi, so maybe your closing remarks, and then we take it from there. Thanks.
Actually, I feel embarrassed, but actually, I have a question.
No problem.
So basically, my wife and I, she was telling me that, you know what, we need to, she wants us to join, to be members of clinical care platform. Because
Okay.
even though I do ophthalmology, I mean, I still see patients on, especially
Yeah.
HIV, you know, there's certain topics that are of interest to me. Now, if I register now,
Yeah.
is my 12 month like, or does it mean that I only register for until December? How does it
Oh,
work?
yes. That's a very common question. So you start membership anytime and it will last for
Mm,
12 consecutive months from your date of starting.
okay.
Yeah, so it's not like yeah, I'm sure you got it. From you
No, I got
count,
it. I
yeah,
got it.
you if yeah, 12 the basically
Yeah,
next year the
yeah,
same time you'll be due for
yeah. So
renewal.
that's my closing remark. I'm sorry.
All right, colleagues, I've shared the link as well for joining membership because there's more value. There's so much that we are really trying to do here. So yeah, thank you, colleagues.
Okay.
May I wish you a restful night with your families. Bye.
Bye-bye. Thanks.
Missed our latest webinar? No worries. We know life gets busy, but your professional development shouldn't have to wait. That's why we've created webinar micro lessons. Short, focused recaps of our full sessions designed to help you catch up quickly and still earn your CPD points. These bite-sized lessons are available exclusively to active subscribe members. So even if you miss a live session, you never miss out on the knowledge or the CPD points. Not subscribed yet? Now's the perfect time to join. Get access to all future webinars, every micro lesson, and more. Visit www.clinicalcareplatform.com to sign up